Let's say you're working with your very first patient who had a traumatic brain injury. More than likely, you're going to be wondering, where do I even start? Especially if your patient had a diffuse TBI and there's a lot going on. Things that can be affected like attention, memory, executive functioning, swallowing, and motor speech. Here are 3 things that you could get started that are really functional with your patient who had a TBI. Number 1, work on attention. A lot of your patients who have TBI will have issues with attention. Your patient may even have difficulty attending long enough to pick up their spoon and bring it to their mouth for eating. So really functional speech therapy tasks could be to help them with environmental modifications, working with care partner training to help them identify what an attention impairment looks like to give the patient cues on how to attend. Another really functional thing you could do to help your patient with a TBI is to call on the team. Your patient is likely going to have a lot of things going on. Don't try to go it alone. You're not meant to go it alone. You have a lot of team members who are there to help your patient too. So occupational therapy, for instance, can help with things like hand-eye coordination, help with cognition, help with visual spatial issues. Physical therapy can help with positioning when the patient is eating, so they're more supportive, so your patient can attend to bringing the food to their mouth and don't have to worry about slumping over. Don't hesitate. Get a referral from the doctor or talk to that team member right away so your patient and you get the support you all need. Lastly, train your patient and their care partners in strategies. Many types of strategies like attention strategies, things like self-talk, things like sticking to doing one thing at a time. Memory strategies like write it down or visualize or repeat. These strategies are things that the patient can take with them and use them even after you've discharged them. They could use them for the rest of their lives. For more information on how to assess, screen, and treat your very first patient with a traumatic brain injury, check out adultspeechtherapy.co.